Now we'll understand the difference between serotonin and dopamine. So, serotonin is happiness molecule whereas dopamine is motivation molecule. Serotonin is responsible for stabilizing the mood whereas dopamine is responsible for signaling rewards. So, serotonin contributes to sleep and digestion, whereas dopamine is important for normal movement and balance. Low levels of serotonin leads to high sensitivity to pain, aggressiveness and insomnia, whereas low levels of dopamine leads to memory loss, loss of sex drive, poor digestion and poor cognition. So, serotonin deficiency is linked with anxiety and depression disorders, whereas deficiency of dopamine is linked with Parkinsonian disease. So, serotonin is effective in the raphe nucleus and central section of the brain, whereas dopamine is effective in the hypothalamus, substantia nigra, and midbrain sections. So, serotonin is inhibitory neurotransmitter, whereas dopamine is excitatory neurotransmitter. The serotonin is a compound which is present in blood platelets and serum, which constricts the blood vessels and act as the neurotransmitter involved in sleep, depression and other neurological processes. Whereas dopamine is a organic chemical of catecholamine and phenylethylamine families, functioning both as a hormone and neurotransmitter and plays several important roles in the brain and body. So these are the differences between serotonin and dopamine, that is what type of this molecule is, what are their functions, their contribution, deficiency is linked with which disorders, what low levels indicates, and then what brain areas is responsible, or whether these are excitatory or inhibitory, or what are other body areas where these neurotransmitters are present, or whether they are hormones or neurotransmitters.